So here is a test. First, you name the 10 muscles that are being pointed at in this diagram. We will give you 10 minutes for that. Okay, we'll give you 5 minutes because you have to be fast. You get 42 seconds to answer an MCQ in the NEET exam. So you have to be fast, you have to be accurate, and you have to be fast also. Speed, accuracy, both important. Now, one is the orbicularis oculi, which closes the eye. The two is the temporalis, which closes the jaw. The three is the masseter, which masseter and medial pterygoid move it from side to side. Then the muscle that you see here is the lateral pterygoid, which actually opens the jaw. The muscle that you see here is the buccinator. Then you have the floor of the mouth by the mylohyoid and the digastric, posterior belly and anterior belly. Between the two anterior belly is the submental triangle, and the two bellies of the digastric along with the mandible make the submandibular triangle. Then the posterior belly of the digastric with the omohyoid and sternocleidomastoid makes the vertebral triangle. And between the two bellies of the omohyoid, they are descending from the hyoid bone. There is the sternohyoid and sternothyroid, and all of this is covered by the platysma. Now, if you take off the sternothyroid and the sternohyoid, you will see the hyoid, then you will see the thyrohyoid membrane, then you will see the thyroid cartilage, then you will see the cricoid cartilage and the cricothyroid membrane. Then you will see the cricopharyngeus muscle, this is the cricopharyngeus. And then you will start seeing the trachea. Between the trachea and the esophagus, which is behind the trachea, you will have two very important structures that are supplying the thyroid. The inferior thyroid artery supplies the thyroid, but the recurrent laryngeal nerve passes behind the posterior lobe of the thyroid into the larynx. Therefore, when you are doing a thyroidectomy, if you ligate the vertebral artery in this groove, then you will catch the recurrent laryngeal nerve. Therefore, the artery has to be ligated with, because it arises from the subclavian artery. It arises from the subclavian artery. This is the first strip. So the subclavian artery would pass like this, and it has got a vertebral artery, then it has got the costocervical trunk, then it has got the thyrocervical trunk. The thyrocervical trunk gives the vertebral artery. It ascends on the scalnus anterior, then it descends and comes into the tracheoesophageal groove. So you ligate the artery at the apex here away from the thyroid so that you don't catch the recurrent laryngeal nerve while doing a thyroidectomy. So we had covered till digastric. We have covered the omohyoid and the sternohyoid muscles which are attached to the hyoid. Then we have covered the sternothyroid muscles, and we have, from the cricoid, we have descended the trachea and the esophagus, placed the two very important structures, the recurrent laryngeal nerve and the inferior thyroid artery, and told you where to ligate it. And then from the second to the fourth of the tracheal cartilages is the relation of the isthmus, and the two lobes of the thyroid gland rise upwards from the isthmus. The thyroid has 4 parathyroid glands posterior to each of these lobes. So when you have done a thyroidectomy, you reverse the thyroid specimen and see whether you have not also removed the parathyroids. If you removed the parathyroids in the post-operative, the patient will go into hypocalcemia and will die, will have convulsions and will die, and will have coagulopathy, congestive cardiac failure, and convulsions. All 3 C's. Therefore, if that happens, then you have to take out all those 4 parotid glands and plant them back into the belly, into any of the muscles. Let us say the sternocleidomastoid. So after this, the 8th is the omohyoid, the 9th is the sternohyoid, and the 10th is the sternothyroid. So I hope you have been able to understand this. And I have also placed this, or the key on this, which you can sort of take a photograph of and then compare your answers. So now the other questions. What pinches the posterior border of mylohyoid, that blue structure? It's the submandibular gland. Then what has an S-shaped course on the posterior pole of 6A, the facial artery? You see, it has a S-shaped course. First it comes medial to the posterior pole, turns around and goes, then turns around and gets around the inferior ramus of inferior border of the mandible and goes as a facial artery. So that's the facial artery. Then there is one more series of questions. The sternocleidomastoid. The 7th is the sternocleidomastoid. This muscle, this one. This is sternocleidomastoid, and about this what is asked? Is it a flexor or extensor of neck? It is both. The fibers that arise from the sternum and go to the superior nuchal, lateral part of the superior nuchal line are posterior to the axis of flexion extension, which passes through the center of the occipital condyles, and therefore they extend. The fibers that come from the mastoid to the clavicle, cleidomastoid component, that passes anterior to the axis of the flexion extension axis of the atlanto-occipital joint, and therefore they flex. So it is both a flexor and extensor of the neck. What is the name of the problem caused by the contracture of any of the sternocleidomastoid sustained in birth or delivery injuries when you are trying to pull the head by your forceps? Answer is torticollis. So what will be the position of the head in the torticollis? It will be extension. It will be contralateral rotation, and it will be same side lateral flexion, as if you are looking up and to the opposite side. So what 2 points should correct this position? The origin and insertion of the opposite sternocleidomastoid. So you bring the mastoid closer to the sternum and the torticollis will be corrected. If not corrected, you will have to do surgery and you will have to do a Z-plasty of the contracted sternocleidomastoid. So now these triangles. The digastric anterior and posterior belly, lateral to it, the digastric triangle, between the two anterior bellies, the submental triangle. The digastric posterior belly, omohyoid, superior belly, and sternocleidomastoid, vertebral triangle. Sternocleidomastoid, trapezius, clavicle, posterior triangle. And between the sternohyoid and sternothyroid, if you take off these muscles, you will see the hyoid, the thyrohyoid membrane, the thyroid cartilage, the cricothyroid membrane, the cricoid, and the cricopharyngeus muscle supplied by the superior laryngeal nerve. And I have told you this very important cricopharyngeus muscle. Then this continues, cricoid cartilage continues as the trachea. Behind it is the esophagus. In the tracheo-esophageal groove is lying the recurrent laryngeal nerve and the inferior branch of the inferior thyroid artery. So when you are ligating the inferior thyroid artery, you have to ligate it away from the thyroid so that you don't ligate the recurrent laryngeal nerve together with it. Then I told you that if you take off the thyroid, you have to look for whether you have also removed the 4 parotid glands, and you have to replace them if you have removed them. So this much we covered here. The submental triangle boundaries, digastric submandibular triangle, vertebral triangle, posterior triangle, and the omohyoid triangle is the omohyoid posterior belly, clavicle, and sternal component of sternocleidomastoid. It is covered by the clavicular part of sternocleidomastoid and the platysma. That's the roof. So what does it contain? It contains the trachea, it contains the esophagus, it contains the thyroid gland, it contains the larynx and the pharynx. The pharynx is naso, oro, and laryngopharynx, behind the nose, mouth, or the larynx. Then it contains the carotid artery, which divides into the external and internal carotid. You have to remember lots of branches of the external carotid. They are superior thyroid, lingual, facial, superficial temporal, great auricular, lesser occipital, and greater occipital. Then the jugular vein, which is external and internal jugular and their tributaries parallel to the artery. Then to remember the 9th, 10th, 11th and 12th nerves, you have to remember the thyroid and parathyroid glands, and you have to remember these lymphatics. Lymphatics are two rings. One is the outer ring, the other is the inner ring, and we'll place them on this diagram. So lymphatics will place blue, submental, submandibular, jugulodigastric, great auricular, lesser occipital, greater occipital. So these are the outer ring. And then the vertical chains are jugulodigastric, jugulomoid, supraclavicular. So these are the vertical rings. So this is the outer ring, starting from submental, submandibular, preauricular, postauricular and occipital. And inside the mouth you have sublingual, you have tonsils on both sides, and you have the nasopharyngeal tonsil. So we have done this, and this is all for today.